Hi, I'm Dr. Leonard Gordon, Clinical Advisor for Van Hook Dental Studio. We're here today to demonstrate how to do the Gordon protocol to maintain both vertical and overjet with regards to an all-on-4 immediate load type of restoration. Today we're going to do a double. I'll show you how to do a single Gordon protocol, but also you'll see how to do a double Gordon protocol. I'm here today with my son, Dr. David Gordon, and we're going to show you exactly how it's done. May I have the bite registration, please? First thing you do is ask the patient to close down. You don't ask the patient to bite. Close down. Because the patient has been in this acquired bite for months and months, you'll find that the patient automatically goes to the proper position. I've already asked the patient has no muscular problem, the patient is able to eat appropriately, so this helps to maintain the vertical. If you're doing a dual Gordon protocol, then you'll need to have 2 bites actually. Don't open. Okay, open please. What I like to do is cut off a certain amount of the anterior bite, reinsert it in the patient's mouth, close down please. You see the patient closes right into there. Open, please. Now we'll take a second one. Close down, please. Now you always ask the patient to close down, not to bite down. If you tell them to bite down, they tend to posture anteriorly. So this is just closed down, and she's doing it wonderfully. Okay, open please. Good. Now again, I'll reinsert it. Close down. Good. Open. Okay. One more time. Close down. Okay. Open, please. Good. Okay. Now, the next thing we're going to do is to remove the GI mask that are in the holes. Once all of the coverings are taken off of the access holes, then what needs to be done is the temporaries need to be removed. I like to use a hand screwdriver. First, what I usually do is undo one of the anteriors. Then I do posterior. Then I undo a second posterior. When you hear a click, it means that the screw is disengaged. Then I undo an anterior. Now, when this is removed from the mouth, make sure not to drop the screws. Keep it turned right side up. Remove it from the mouth. The single arch Gordon protocol is you'll have the screws, you'll have the prosthesis, you'll have one of the bites that you took, the screwdriver, you'll have actually both the upper and the lower study model. In this case, what we'll do is we'll just be using the upper study model, and that's how you start with. This is how you'd restore a single arch. Then what you do is take the prosthesis, put the prosthesis on, and screw down each of the screws. Then you take one of the bites that you've taken, place it over top, make sure that everything fits down fine. Then what you do is take the upper model, and the upper model should seat exactly on that. You wind up holding this. Now, the lower has a mark of how low when we start doing the next phase it should go down, and the upper doesn't have a mark, but what you do is you always add things past where the little marks are. There's a firm hold on this, and the doctor should hold this so it doesn't move. What the assistant will do is go from upper to lower model to capture the relationship. And then you hold this while it sets. Now, you'll check to make sure it's firm, and then what'll happen is you peel it away. You peel it away toward the buckle. It seems sometimes like it's difficult to come off, but it'll come off. And then you peel the lower. Away. And if this were single, then you'd be finished. And what this allows is to have the upper study model mounted to the lower working model. Now, what you can see if you take this off is the relationship. This will go exactly on here. You'll see that it fits exactly back down, and then you can see that the upper also fits exactly into this, and that's what the lab uses to mount the upper and lower vertical. Now, since we're doing a double, what we do is remove the maxillary transitional from the mouth. Now, since this is a double, what we do is we now will add the upper provisional to the upper study model. Take the screws and apply the screws. Now, once that's done, what you do is take a second bite that you've taken and add it so you then have the upper and the lower. This will relate the upper working model to the lower working model, and then you do exactly the same thing that you did with the other one. While the doctor holds, now again, you go from model to model without rocking, and then you hold until it's set. What you want to do is completely cover the grooves that are made onto the model. So now you have an upper working model and a lower working model, and this will relate the upper to the lower. Wait till it's set. Again, this goes all the way around. Once it's set, peel off. Again, you're not going to break anything. Peel off toward the buckle. Peel off toward the buckle. Now, what you need to do is take a marker and mark number 1 so the laboratory will know that they mount, in this case, and you write down the lower working model to the upper study model, and you'll put number 2 so the lab will know that they'll mount this after they've mounted the lower verified model to the upper study model. Then they'll mount the upper verified model to the lower verified model. The last step is you go through and put back in the GI mask to cover the holes up once the prosthesis has been put back in. Now the GI mask is put back in. Now one last thing what you want to do, if you'll smile big please, smile. You need to analyze the bite to see where the bite is, to make sure that if the midline is off, you're going to want to correct the midline. The maxillary midline here is proper. We're going to want to bring these teeth up and back. So you need to analyze this and send to the laboratory how you want them to set the teeth, because the next time what is done is it's a wax try-in with teeth. When the models are properly mounted, you need to direct the lab where they can put the teeth. In order to check our work, what we do is take the bite, put it back on. Now this would be the first if it was just a single. And then we take the upper model, and the upper model should just lock in as it does. And this is what the laboratory sees, and this is exactly the vertical of what the patient had in the patient's mouth, the vertical in the bite. The laboratory mounts you have the upper study model that's already been mounted, and they then take the lower working model, place the lower working model on here. Then what they wind up doing is just mounting this to the vertical, and as you can see, it's very stable, and then they just add plaster. Now, to double check a double, what you'll do is take bite number 2, and bite number 2, the upper should lock into it exactly. Ideally, it should have come up in there a little bit more, but it's still very stable. Then you put the lower, and the laboratory then, they now have the upper mount, the lower mounted, so you wind up mounting the upper to the lower, and you have the exact relationship of the upper to the lower, and the bites are locked in. I'm Dr. Leonard Gordon. Thank you for viewing the maxillary mandibular all-on-4 Gordon protocol. Thank you.